Minister, I want to ask you in relation to the advice given by the Chief Medical Officer that the restrictions on nursing home visits were premature. Will you acknowledge that vital time was lost and that this is now contributing to the fact that there are over 200 clusters of this virus in congregated settings across the state? This is an issue that I have raised repeatedly with the HSE. 2 weeks ago, I was advised that teams of infection control people would be going into nursing homes. Yesterday, I asked what should be a fairly simple question around the exact number of personnel that are involved in this, and they were not able to answer. I'm going to put it to you, Minister, if this is a priority, and you'll need to convince us that it is, if it is, well then you should be able to tell me how many staff are actively working in the nursing home sector, because for 29% of the nursing homes that were surveyed by Nursing Homes Ireland, they have not received contact from the HSE. So if we're going to be proactive, and you're going to be proactive about managing this pandemic in the nursing home sector, well then you should be able to tell me how many people are actively involved on it. I have 4 questions, Cathaoirleach, so I'll take them all together. Minister, I want to ask if you'll publish in full the deal between the state and the private hospitals. So we understand that An Taoiseach has confirmed it's in or around €115 million per month. My understanding is that that is the absolute minimum that will be paid. Can you confirm if there is a minimum figure that has been set, and indeed your estimation of what the maximum figure will be? Is there also a minimum amount of time for which this deal is in place? So, for example, have we purchased a certain number of weeks, months, days, or however from the private sector, and are we obliged to pay for that regardless of whether or not it is used? You might also tell us how many people are currently in the private hospitals and how that is being utilised. Minister, can I ask a question with regard to swabs that were taken before the case definition was changed? I have seen on social media medical personnel tweeting that, in their opinion, some of those swabs may have been discarded. We know that there are people waiting, in some instances, more than 3 weeks for the results of tests. They don't have very much confidence that they will ever get a result. But can you confirm that every test that was taken, every swab that was taken, will be tested and a result will be advised, or indeed that the people will be advised that, although they had a swab, it won't be, the result won't be notified to them? And Minister, I want to raise with you the case of a woman by the name of Paula. She works as an SNA in a school for children with special needs. She finished work on March the 12th. She became ill on March the 15th. She was tested on March the 23rd, and she's still awaiting confirmation of her result. This morning, she contacted the National Virus Reference Lab herself, and she was advised that a positive test had been sent back to Public Health. 4 days, actually, so fair play. There was a quick turnaround time. Nobody told her. In the intervening time, her daughter has had a test cancelled because she didn't fulfil the criteria. Her daughter has subsequently become ill. Now, this family did everything they were supposed to do. They isolated, but she was left chasing that result for herself. So, Minister, I want to ask how many people are currently working per day on contact tracing, how many contacts have been traced for the last fortnight, and if you could provide that either here or in written form, I'd be grateful. Thank you.
Thanks, Deputy Minister. To respond in about 3.5 minutes.
Thanks very much, Deputy. I dealt with the question of the Chief Medical Officer's comments on restrictions just from Deputy Pringle earlier, but Deputy McNamara. Other than to say, I think it is important when you're putting widespread national restrictions in place that it comes from the NPHET, from our clinicians, and I stand by the judgment of the Chief Medical Officer. He never said, just to be clear, that individual nursing homes or individual hospitals or individual anywhere couldn't put in restrictions. But the idea that blanket restrictions are put in place, or restrictions on any of our movements by anyone other than the NPHET, is not a place I go. I think the NPHET is the right structure to do that. In relation to the priority, let's be clear, nursing homes are a priority. I don't think anyone will doubt we're all unified in relation to this. We need to take some serious actions in this regard. The answer to your question is 61. There's 61 direct staff is the last figure that I saw working in our nursing homes as of today. It may have gone up since then. That's the figure I have. There's 18 COVID response teams in place. It does take time to put these in place. Progress is being made. Incredible leadership shown by the union movement yesterday in terms of everybody agreeing to the redeployment agreement. Really, really good progress that will make a difference. I want to thank people for that. We're seeing substantial PPE deliveries. We've seen training in PPE and PPE usage rolled out across the nursing home sector with over 1,000 participants. We've seen a situation now where 183 nursing homes have access to telephone advice and support, 180 have accessed infection prevention and control support, 162 have access to public health support, and 171 PPE support as well. A couple of specific questions you had in relation to the private deal. I've sent that to the Oireachtas today to lay it before these houses. I fully agree with you. It should be out there. It should be transparent. People should see it. Let me just say very briefly in relation to that. Under the terms of the agreement, the HSE will secure 100% of the capacity of the private hospitals. The hospitals will work in cooperation with the hospital groups. The heads of terms have been signed by the 19 acute private hospitals, and it's expected that final contracts with individual private hospitals or groups of private hospitals will be agreed shortly. The arrangement is in response to the COVID pandemic. It's for a 3-month period with an option for the HSE to extend it for a further month and by mutual agreement thereafter. It's not possible to indicate a precise cost estimate for the use of the private hospital facilities, as the rationale for the arrangement relates to the COVID-19 epidemic, for which no one can provide a definitive time horizon. But there is significant safeguards, including eligible costs, third-party verification and termination, built in against a necessarily uncertain disease background. Under the arrangement, the private hospital's recent management accounts will be examined by a firm of accountants acting on behalf of the HSE. Payments will be determined on actual costs incurred and will be subject to verification, and as part of an agreement, a process being put in place to resolve any disputes. Under the arrangement, a participating private hospital is due 80% of its estimated monthly costs in advance from the HSE. Costs incurred are subject to verification, as I've just set out, and any difference is subject to a clawback in the subsequent month. And the HSE has made advance payments for April, totalling 90.2 million. This is based on estimates provided by participating hospitals and will be adjusted. I want to say this importantly before people say that's the final figure. Will be adjusted based on verified actual costs. Can I continue, or was that a bell to tell me to stop? In relation to Oh, I'm sorry.
Yeah.
In relation to the issue of swabs, just to be clear, I've asked the HSE, and it's my understanding from the HSE that swabs do not expire and were not discarded. The backlog, as you know, has been processed with the assistance of a German lab and additional lab capacity here. We're now seeing on average 1,200 swab requests per day from our GPs. That doesn't include our hospitals. And just finally, in terms of contact tracing, I don't know the individual details, happy to take them from you. In relation to that, we now have 9 contact tracing centres, 1,700 people trained to date, and on average just over 200 people deployed per day to these centres over the last week.
Thanks, Minister. Deputy